and Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpretation is provided by Mary Thiessen, and our French language translation by André Boursier. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have 2 questions. Premier Silver.
Thank you very much, Pat. And hello, everybody, and thank you very much for joining us today on the traditional territory of the Kwalin First Nation and the Ta'anquatchik Council. It's really good to be here with Dr. Hanley and with Mary and the team. Last week, Minister Richard Mostyn announced our plans to lift some of the restrictions that are in place as of August 4th, based upon new recommendations we've received from the Chief Medical Officer of Health. And today, Dr. Hanley and I are here to explain the current situation in more detail. I know our plan to lift restrictions has caused both excitement and concern, as well as confusion. I want to thank everybody for tuning in today to hear the most accurate and up-to-date information about the current situation in our territory. We have been living and dealing with COVID-19 since March of 2020, and a lot has changed during that time, and you all know. Aside from the fact that a highly contagious and dangerous virus was quickly spreading around the world, not much was known at that time. Nearly 16 months ago to the day, we declared a state of emergency in response to the global pandemic. This was done so that our government could rapidly deploy resources to protect Yukoners and limit the spread of COVID-19 in the territory. It provided us with a number of tools to ensure that we could respond quickly to the threat of the virus and effectively support Yukoners. Now, throughout the pandemic, our number one priority has always been to protect the health and safety of Yukoners. From the outset, our response has been guided by the recommendations of Yukon's Chief Medical Officer of Health. Dr. Hanley and his team of public health officials have done the difficult and incredibly important work of researching the growing body of information of COVID-19, the variants, following the epidemiological data across the country and around the world, and identifying the risks to Yukoners of this new virus and the variants. The pandemic has been and continues to be a dynamic situation, and the associated risks, well, they've changed over time. Our government's response has adapted over the past 16 months to address the risks and to protect the health and safety of our territory. Early in the pandemic, the greatest risk that we faced as a territory was the importation of COVID-19 from the outside. To address this risk, we introduced border control measures to control the spread of COVID-19 in the Yukon. Later, the transmissibility of COVID-19 was better understood. We introduced measures to limit the spread of COVID-19 within the territory. This included limiting sizes of social and public gatherings, as well as restrictions on capacities at bars and restaurants, and the mandatory use of masks in indoor public spaces. These were quite significant measures for a government to take, because they limited the ability of individuals to exercise the rights and freedoms that we enjoy as Canadians, that are enshrined in our Charter of Rights and Freedoms. These measures were introduced based upon recommendations from Dr. Hanley and his team, and they were justified to protect the health and safety of Yukoners. Indeed, they have been integral in limiting the spread of COVID-19 in our territory. The past 16 months have truly been extraordinary times, and they have called for extraordinary measures to protect the public. As a government, we are, of course, bound by the Charter in all of our actions. We also have the duty to protect the health and safety of Yukoners, and we continue to take this duty extremely seriously. As leaders, we need to strike a balance between individual rights and public safety. When the risk to public health increases and requires extraordinary measures, as it has in this pandemic, we have endeavored to infringe on the rights, the individual rights, in the least intrusive way. We recognize that these restrictions have negative impacts to mental health, and also to well-being in general. By the end of 2020, as a result of unprecedented coordination of international efforts and resources, we learned that vaccines for COVID-19 had been developed. The news of vaccines was a light on the horizon after months of darkness, anxiety, and extremely challenging times for everybody. It provided a new tool to fight COVID-19, a much more powerful tool than we have with the civil emergency measure toolbox. We worked together with our partners across the country and across the territory, but with our federal counterparts to ensure that we had priority access to those vaccines, and we accomplished that. We negotiated very hard to make sure that rural, remote, and Indigenous communities had access to vaccines first. In the first days of 2021, we launched an aggressive vaccine rollout, starting with the most vulnerable communities, Watson Lake, Beaver Creek, others. We give a big shout out to Team Balto and Team Togo, Team Fox here in Whitehorse, along with all of the public servants that joined in the vaccination rollout. We undertook the greatest vaccine campaign in Yukon's history, and it was extremely successful because of Yukoners, because of what you've done. As of Monday, 80% of Yukoners adults are fully vaccinated. We've also worked with federal partners to get access to vaccines for all of our youth, age 12 and up, as soon as they were available. Now, more than 60% of Yukoners aged 12 to 17 are fully vaccinated. This is absolutely phenomenal. If there's one thing that we've learned over the past 16 months fighting this virus, is that getting vaccinated is absolutely the best way to protect yourself against COVID-19. It significantly reduces your chances of getting COVID-19 and suffering serious medical complications or even death as a result. I want to thank the Yukoners that have recently shared their stories about the devastating health impacts of catching COVID-19 and how it has helped them to overcome their vaccine hesitancy and urge others to take the shot. The vaccine provides much greater protection than border controls, than masks, than physical distancing. Quite simply, the vaccine saves lives. Every single person that steps up to take their shot is helping to protect themselves and the rest of our community as well. The vaccine has completely changed the landscape when it comes to COVID-19. As Dr. Hanley will tell you, the use of vaccines here in the territory and across the country and around the world has significantly changed the risks associated with COVID-19. As vaccine rates have increased throughout Canada, the case counts have gone down, the risk of importation of COVID-19 has decreased substantially. The border control measures that we introduced to protect the health and safety of Yukoners are no longer justified based on the current risk. To put it another way, that tool is no longer appropriate to the task that we face in the current phase of this pandemic. This means there will be changes to what Yukoners and visitors can expect at road border stations and at the Whitehorse Airport. As of August the 4th, our government will no longer be collecting declarations, forms from incoming travelers, for example. Travelers will no longer be required to stop at the border stations in Watson Lake or at Junction 37. And those arriving at the Whitehorse Airport will no longer be met with SEMA enforcement officers. The 24-hour limit for those transitioning through the territory will also come to an end. I would like to take a moment to extend a sincere thank you to everyone who has played a role in Yukon's border measures throughout the pandemic. Most of the folks that are at that border have other jobs. We had to adapt many times throughout the pandemic and work very closely with our partners in other levels of government. To the people who have coordinated the various border controls as the situation evolved, to the folks on the ground at the border stations and at the airports providing information to travelers and receiving declaration forms, I thank you very, very much, and our government thanks you very, very much. This monumental effort, again, has been integral to our government's response to COVID-19 and to keeping Yukoners safe over the past 16 months. The folks on the helpline as well, thank you. Well over 30,000 people have transited through our territory without contributing to our case count. That's a very important statistic. The mandatory use of masks in indoor public spaces and the restrictions on bars and restaurants, they're also tools that are no longer needed based upon the current situation. Once we received these new recommendations from Dr. Hanley, we took action right away. As I said, throughout the pandemic, we've endeavored to protect public health by impacting individual rights in the least intrusive way. Last spring and summer, as new case counts grew, there was no vaccines in sight at that time. That meant introducing further restrictions to protect the health of people in the Yukon. Now, with 8 out of 10 Yukoners fully vaccinated and case counts decreasing, the restrictions, as I said before, are no longer justified, and we have a responsibility as a government to lift them. We're announcing our plans 2 weeks ahead of time from the date because we also know that this is a big change and that people need time to prepare and to adapt. Now, Dr. Hanley will have more to say about his recent recommendations and what they mean for the bars and for the restaurants in particular, but I want to be clear that we are not hanging up our gloves and walking away as though a job is done. We're transitioning. We recognize that we are not out of this pandemic yet. Far from it. Even though we are getting closer, and every dose of vaccine is delivered is another reason to rejoice. There are still going to be restrictions on social and organized gatherings after August the 4th, because that is where the spread is occurring. Now, Dr. Hanley has made it clear that there's still risks associated with large gatherings, so we are keeping that tool in place to address that risk. But when that risk goes away, we will be reconsidering the use of that tool. Our priority remains protecting the health and safety of Yukoners and supporting them through these extremely challenging times. We are simply adjusting our approach and using the appropriate tools to deal with the current level of risk that we face in the territory. We have one of the highest vaccination rates in the world, and that means that we are entering a new stage in the pandemic, and we are dealing with a new paradigm. We continue to follow the recommendations of the Chief Medical Officer of Health and act based on the best scientific information and evidence available. Now, I do understand that there are certain concerns about this move, but we are still actively managing COVID-19 situation, and we have plenty of tools that we are using to keep our territory safe. My colleagues and I have been having lots of conversations across the territory with leaders, First Nations chiefs, mayors, council members, other community leaders, and we are listening closely to the people of Kwantlen-Dun, Liard, Champagne, and Ajax. Slow down, sorry, Mary. Ross River, Dena Council, the Vunta-Quichin. I absolutely hear your concerns. Our government is here for you, and we are committed to working collaboratively to keep you all safe and to keep all Yukoners safe. We share concerns about the impact of COVID-19 on our vulnerable populations. We have support workers working 7 days a week to support vulnerable individuals that need to self-isolate. They provide wellness checks, social connections, referrals to other services, support with accessing personal items and getting help as needed. Our folks work directly with each individual that needs to self-isolate to ensure necessary supports are provided for social workers, for support workers, registered nurses, outreach licensed practical nurses, and also physicians. This includes accommodating those that are self-isolating and need withdrawal supports. It also includes providing nicotine, cannabis, or alcohol as required in consultation with medical experts. We continue to work with our community partners to adapt as necessary and to ensure supports are available when and where they are needed based upon the current situations. These comprehensive supports are some of the tools that we continue to use to manage the pandemic. We are also deploying rapid response teams to communities to enhance testing in order to contain the spread of COVID-19. Now, this is a relatively recent tool that we've deployed, and it has been very successful in containing spread. A team is currently in Watson Lake, ensuring people have easy access to testing and support if they test positive and if they need to self-isolate. We also have expanded our vaccine rollout. Our new Minister of Health, Tracy McPhee, informed me this week that all Yukoners born in 2009, even if they have not yet turned 12, are now eligible for the Pfizer vaccine. Mobile teams are also returning to communities this week to run vaccine clinics for first and second doses for all eligible people born in 2009 or earlier. The clinic is in Haines Junction today, Watson Lake tomorrow. Here in Whitehorse, the clinic is open to all ages on Tuesday and Thursdays from 9 a.m. to 4:30 p.m. and on Wednesdays from 12 p.m. to 7 p.m., providing access in the evenings. At all of these clinics, we encourage folks to book appointments so that we can plan ahead and limit the potential for wasted vaccines. But I want to be clear that walk-ins are accepted in all of our clinics. If you find information and book an appointment online, you do so at yukon.ca. I am told that yukon.ca is down right now, but it should be running again very, very soon. We have enough vaccines for everyone that wants one, and we are incredibly fortunate to be in that situation. We all need to keep that in mind. The past 16 months have been very challenging. They've been life-changing. The vaccines, they're our way out of this pandemic. Make no, that's basically the best tool that we have. The vaccines are here. They're our best tool, so please step up, take your shot. Encourage your friends and your family members to do the same. Have these conversations. Testing and rapid response teams, clinical support networks, social support workers, expanded vaccine access. These are just some of the tools that we are using as part of the new paradigm that we're in. We also need to continue to work together and to support each other to feel safe, to feel comfortable in this new paradigm. Over the past week, since we announced our plan to lift some of the restrictions, several communities and organizations have announced that they will continue to require, for example, the use of masks and other safety measures after August 4th as a precaution. This is very good to hear. It's very important for us to adjust to this new paradigm, to take the steps necessary to ensure that we all feel safe and that we all feel healthy and protected as we live our lives. Just because masks will no longer be required after August 4th, it doesn't mean that you're not allowed to wear them anymore. It only means that we can't enforce the use of masks through tickets and fines anymore. Nevertheless, we strongly encourage you to respect businesses, organizations, and communities that continue to request you to wear your masks going forward. And we continue to ask those organizations to remember the advice and the recommendations from the Chief Medical Officer of Health and his team. That will continue. It's not unlike when Dr. Hanley no longer recommended avoiding non-necessary travel to communities. It's still very important to travel respectfully and to follow the rules that are in place when you get to these destinations. It's also very important that we continue to practice the Safe Six. Each of us have a role to play in keeping our territory safe because our individual decisions, they impact the health of everybody in our community. That has always been the case, even before the pandemic, and it will remain the case once COVID-19 becomes as common as the flu. We still need to look after each other. We still need to be kind and patient. We still need to be Yukoners. We are all in this together, and we're going to get through this together. And we have. Over the last year and a half, this virus, as terrible as it's been to everybody, it really has pulled us together as a community. Our vaccine rates, they're growing. and our case counts are decreasing, and we're moving in the right direction. And we need to keep going. I know a lot of families are thinking about the next month and, when students will begin to return to schools. Dr. Hanley and his team are working diligently with the Department of Education to plan for the upcoming school year, and there will be more information at next week's update on that. Thank you very much, folks. Appreciate your time today.
Premier Silver. Dr. Hanley?
Thank you, Premier Silver. Good morning, everyone. Bonjour. Well, last week was another eventful one in our long journey as the lifting of measures for self-isolation, the end to mandatory masking, and changes to bar and restaurant rules were announced. And the news quickly became talk of the town. As always, reactions were mixed, and I know that many, particularly amongst First Nations and communities, felt that the rug was being pulled out from underneath the careful structure of safety that we have built over the last 16 months. So today, my goal is to provide further clarification to these announcements and to present what our new package of protections will look like as we move past the emergency phase and into a new paradigm of long-term living with COVID-19. Now, for our status of cases, as of the end of yesterday, there were 89 active cases of COVID-19 in the territory. 426 people have recovered since this wave began. Of course, 4 Yukoners have died since the wave began in June, and 6 overall since the onset of the pandemic. As of yesterday, 52 people overall have been hospitalized, of whom 43 were either unvaccinated or partially vaccinated. 14 people have been medevaced out of territory for further care, of whom 11 were unvaccinated. And most of these patients are still presently in hospital care down south. In our situation, 399 of our cases as of yesterday are those who are unvaccinated or partially vaccinated. 75 of the cases, about 14%, fully vaccinated. If we look just at adults, about 19%, or almost 1/5 of adults' cases, are fully vaccinated. Again, most of these individuals have had mild disease, although some with more underlying disease have suffered more illness or been sick with COVID as well as coexisting medical conditions. We're currently seeing clusters in the Watson Lake area as well, and these cases largely consist of 3 larger household clusters. A number of contacts are in self-isolation, and we do expect to see more cases here. And these clusters have pushed our overall case counts higher in recent days, with 28 active cases in Watson Lake at last count. So, as the Premier mentioned, in response to this situation, we deployed a rapid response team made up of testers plus supporting staff, including cleaning and administration staff. And in order to keep the Watson Lake clusters under control, as well as ongoing contact and case management, the rapid response testing team will return to Watson Lake and 2 Mile and Upper Liard next week, and details will be posted in the community and on yukon.ca. These Watson Lake cases are showing us once more how this virus is seeking out susceptible hosts, those who are unvaccinated. Please be cautious and assess your risk if you cannot or choose not to be vaccinated. You need to be cognizant of your risks, and you need to act accordingly. This means assessing daily for symptoms and assessing risk levels before engaging in certain activities that involve gatherings or mixing of people. Contracting COVID-19 while in higher risk settings such as informal gatherings or households with infected individuals is a very real threat. Now, before I move on, I thought I would bring some slides to review with you today, and I hope this helps to provide some insight into what our upcoming months may look like. And I think it's a demonstration of our overall risk levels of importation as we begin to reduce measures such as self-isolation. So what you're going to see is three graphs where really it's showing the same thing in different ways. And what we're seeing in these graphs are estimates of risk of importation looking back as far as the end of last year, December 2020, and looking ahead towards the fall. And the first graph talks about the daily probability of an importation of COVID based on incoming travelers. So that's either, and in fact, more recently, largely driven by Yukoners going out and coming back. But increasingly, that is also mixing with travelers who are coming from outside Yukon coming in. And so you see, for instance, that when we look to last spring of 2021, March, April, May, we had the daily probability of at least one importation up as high as 30, 40, 50%. And now you see that we are dropping in August towards less than 10%. Now we do anticipate some rise in that risk, but a moderate rise in that. Green line is projected rise through the fall based on rising prevalence in the provinces and in the United States, based also on the presence of Delta variant. Looking at this, really the same thing in a different way. This is the probability that any given traveler is infected. And so then we get into, is it, 0.2%? You see a peak in April, 0.6%, for example, and then you see us really quite close to zero at the present time. So you see how our actual risk of importation now is lower than it has been actually since the onset of the pandemic. And why is this? This is because low case activity in Canada overall, and even with an increase that we do anticipate and we are already seeing, ongoing low risk, overall low activity in Canada, and of course increasing vaccination status in Canada. So that increasing vaccination, which will be ongoing, is competing with the rise that we're seeing, or this a possible onset of a fourth wave driven by Delta. So you see those things playing out, but that dynamic overall is still showing that the given risk of an individual being infected coming across the border is low. Now, these are models, of course, that we will be repeating based on traveler information, based on estimates of incoming travelers, and based on prevalence of COVID activity in the provinces and also in the United States. So this is something that we can revamp regularly. And you see the little yellow triangles are known actual importations of COVID into Yukon. So again, another way of doing it, this is how many importations over a week were we likely to have seen or to have had, even without seeing them. As you can see, we probably only document some of these importations. So you could see that back in April, we would have had about 5 importations a week, many of them unrecognized. And as I have said many times, introductions where people do the right thing are really not a concern to us. It's introductions that then become associated with doing risky things like attending house parties or informal gatherings where someone is infectious. That is what we get worried about. So you can see that the actual weekly importations are close to zero going forward week by week. It will therefore take several weeks actually to get to have a single importation based on current activity outside of Yukon. So as I'll explain later in my notes, we actually have kind of an opposite of risks to what we previously had, where we really had a need to focus on risks based on COVID activity outside our borders. Now we have significantly more COVID activity within our borders. So this just shows a graph. If we were to have random attendance at gatherings based on our Yukon prevalence, the probability that an infected adult would be attending a gathering based on the number of people attending. So we see a linear relationship or linear graph. The more people attending a party based on, say an informal gathering, based on our current prevalence of COVID in Yukon, goes up linearly. So 100 adults attending a party right now, kind of random. If we just took a bunch of random Yukoners from around the Yukon, put them into a house party, there would be a 15% chance, for example, of someone being infected. So this is where we have to rethink our whole strategy and no longer look outside the territory towards the border, but look, what should we be doing? What can we be doing better within the territory? So more COVID transmission through unorganized gatherings than through travel is what we are currently seeing, and which we are at risk for that for the time being and for the weeks ahead. And of course, the likelihood of being exposed to COVID increases linearly or significantly with the size of the event. So that means that that was why our initial focus on reopening was on borders, on removing quarantine requirements, but holding on for the time being to gathering sizes as our prime risk area. So we have reached a pivotal point in our journey as we begin shifting from a state of emergency to living with the risk of COVID-19 as an endemic disease, where we know COVID-19 is present, but with appropriate mitigations, COVID-19 does not need to dominate our daily lives. And I think many of us are beginning to accept that there may not be a final inning to this pandemic. No waking up one morning to find that life is just as it was 17 months ago. And this virus is, like floods and climate change, part of our new reality. To review the August 4th changes in the orders, of course, self-isolation after domestic travel will no longer be required. Bars and restaurants will be able to return to full capacity, and masking will not be enforced in indoor public spaces. And I'd like to take some further time to explain each of these measures, as well as to explain what protections I'm recommending for the road ahead. For what may not have been talked about enough last week is that August 4th is, as the Premier said, it's not about letting go. It is not about leaving the pandemic behind. It is about becoming smarter about how we match measures to risk, recognizing that we are in a much different place than we were a year ago when vaccination was still a distant dream. Each of these adjustments in measures will be compensated for with augmentation of other measures so that we can remain protected with a readjusted balance in order to live our lives more freely. As the Premier explained, removing the quarantine requirement at the borders is in recognition that such a heavy and blunt instrument is no longer justifiable based on either the risk that we're trying to address, as I've shown in the slides, or the intrusion on individual liberty that now entails, now that we have vaccination as our key protective measure. Vaccination, not border control, is now our safety net. In fact, the risk of acquiring COVID infection from someone traveling into the territory is actually lower than the risk of acquiring infection from contact within the territory, the first time that we find ourselves in this position. And though the measure of quarantine requirement has served us well over the past year, we have always acknowledged the toll this restriction has taken on workers, families, tourism, and other industries depending on flow of people and goods back and forth across the border. With the high vaccination rate that we now have, a measure like this can no longer be justified by the costs it incurs, not just to finances, but to our mental health, our autonomy, and our economic vitality. It is a principle not just of justice, but of public health, that we should take the least intrusive means possible to achieve the public good that we are aiming for. Likewise, removing mandatory masking is a recognition that with 80% of our adults vaccinated, carrying on with a territory-wide rule is too blunt and onerous an instrument. Instead, I hope that mask wearing will become an enduring tool that with informed risk assessment we will learn to use in the right circumstances, but at the same time be comfortable with not wearing one in low-risk circumstances. Guidance on how to estimate that risk will come. Like the Premier, I fully support events and establishments and municipalities setting their own rules for mask use, particularly during these times of high COVID activity. Our office is happy to help by providing or linking to resources to help decide when masking is recommended. Meanwhile, as the mask mandate expires next week, if you are still asked to wear a mask before entering certain establishments, please do so. Now for bars and restaurants, another area of change that has invoked much angst. In fact, the changes that we proposed are, again, logical increments in moving towards normalcy while maintaining reasonable restraint. The change that we recommended to government was to allow bars and restaurants to return to full capacity by allowing normal spacing between tables and to remove the 2-meter spacing requirement at the counter, which, based on feedback from industry, we understood as a substantial impediment to being able to run a profitable business. The changes we proposed are not an invitation to visit between tables. They are not to ignore physical distancing between customers or to turn up the music and dance. Eventually, we hope to get there too, but not yet. As always, our recommendations are incremental and measured. We will publish in detail the revised guidance, and we do intend to meet once again with bar and restaurant operators to make sure that the guidance is clear and that questions can be answered. What we are not changing are the following: stay home when sick and follow recommendations to get tested. Have hand sanitizer with at least 60% alcohol available upon entry and exit for customer and staff use. There is still no mingling between tables. There is as yet no dancing in the establishment. And physical distancing is still required for people while waiting for a table, paying for the bill, or moving around the facility. Quarantine, masks, and bar and restaurant changes. These are the changes that are coming into effect as of August 4th. So what remains? For now, SEMA remains, and that is mostly around restricting gathering sizes, an area, as I said, where at present our greatest risk for COVID spread lies. In addition to continuing to observe the Safe 6 and to mask up when recommended, gathering size orders are still in place. In the weeks ahead, we do anticipate moving away from these limits as well, so that we can replace orders under SEMA with CMOH guidance that is more focused and more gauged to individual risk assessment. Our aim as we move away from a civil emergency is to live with this virus without the need for broad state intervention or restriction. Rather, I hope that we can provide guidance that works as a point of reference on how to live and adjust to living with COVID-19 without the need for enforcement, except when required under the Public Health and Safety Act. This guidance will essentially provide advice to ensure Yukoners feel comfortable assessing the risk of attending gatherings or events, determining when a mask should be worn according to the risk and circumstances, advice for traveling or attending larger gatherings or mixing in smaller gatherings. Living with COVID-19 means continued vigilance, public health surveillance for disease and new variants, management of cases and clusters as they appear, and using our full toolbox of continued vaccination programs, testing, social supports for vulnerable people, focused public health measures, and surge capacity. We can do all of these things without upending most people's lives. Part of living with COVID is going back to school. All grades, face-to-face classes. And we are meeting with education officials to discuss what return to school will look like this year and what guidelines will be in place to ensure our students and staff are adequately protected. I know parents are looking at the calendar and next month's return to school. We are planning for next week to be able to offer more details on what our guidelines will look like for return to school. A few weeks ago, the Premier and I were discussing how we would be able to sustain our lives beyond SEMA, while recognizing the ongoing threat that COVID poses to our lives, but also with recognition that the threat in a highly vaccinated population is much less than anything we would have faced a year ago. So how do we strike that new balance, and what tools do we need? That led to our development of the new paradigm that shifts our focus away from the borders and onto 5 pillars of action that are more attuned to our reality. Thus, our new toolbox involves a 5-pronged approach. We are looking forward to bringing more detail as we work on the public document that will follow on from our Path Forward document and look to the year ahead and more. Those 5 pillars. Number 1, vaccination as an ongoing strategy, an active vaccination strategy that addresses ongoing hesitancy and seeks to reduce our pool of susceptible individuals with outreach, innovation, and collaborative work with our community partners. Our goal, at least 90 to 90% of our eligible populations. At the moment, down to age 12, and including younger children if and when they become eligible. This is our single most important ongoing endeavor. Our targets must be ambitious and our ideas should be bold. Number 2, testing and surveillance. Widespread availability of testing for rapid diagnosis, surveillance, and screening. This strategy will be developed in coming weeks, but will involve wider distribution of rapid testing for diagnosis of COVID-19, screening tests for sensitive work areas, such as mines, long-term care, and others, and exploring the use of new testing approaches and technologies, such as home-based self-testing. Number 3, social supports for vulnerable people. Although there are many reasons that people choose not to get vaccinated, we have learned and demonstrated in the current wave how there is a strong connection between people who are unvaccinated and people living in vulnerable circumstances. Ongoing investment in social supports such as prevention, building people's resiliency by assisting with housing supports, poverty reduction, access to addiction services and mental health will mean more resiliency to infection and better uptake of vaccine. When vulnerable people are infected or in contact with COVID infection, augmented supports are necessary in facilitating successful self-isolation and thus protecting others from spread of COVID. Number 4, surge capacity. We have also learned in this wave how even with our high vaccination rates that our public health systems and even our acute care services can be overwhelmed. Ensuring that our health system is ready to meet rapidly increased demand will assure not only the high quality emergency care that Yukoners expect, but will also ensure that Yukoners will continue to be served for all other routine acute chronic and preventative needs with minimal interruption. For this continuity and to preserve our valuable public health and healthcare staff, we must maintain surge capacity to be able to rapidly dial up public health and acute care response as needed. And number 5, focused public health measures are also needed, equipping people with tools to make the right choices. Examples, ongoing guidance for what to do when sick, including avoiding work and gathering places. Tools for assessing when wearing a mask is a wise choice, and when physical distancing or reducing gathering sizes is advisable. I've had many rich conversations lately with chiefs and leaders around the territory. We are in a difficult situation with COVID-19 right now, and many communities are still struggling to get through. The unvaccinated are being hit hard, and that will continue even as we work our way through to controlling the wave. COVID also takes a heavy toll on vulnerable people, literally threatening their lives when lives may already be in turmoil. And this wave is hitting First Nations people hard and disproportionately, at a time in our history when we are looking back with grief and regret at the wrongs inflicted through residential schools. Through this whole pandemic, we have fared well, but at a time when we thought this might be over, we are facing some of our most challenging moments. This is why our efforts will and must continue, but in new and reconfigured ways that reflect the successes that we have achieved with strategic public health measures and will continue to achieve with vaccination and the other pillars that I have discussed. Before I sign off, if you're choosing to not get vaccinated, please, for whatever your reason you have, reconsider. Don't get swayed by unreliable sources of information that tout conspiracies and invite paranoia. Instead, I ask you to listen to those who have experienced COVID-19 directly. Listen closely to the stories and experiences of Darlene Jim and Lisa Marie Anderson and others who have related their encounters with life-threatening illness. This virus is no joke, and it will come your way sooner or later if you don't get vaccinated. Let's work together and stop the next wave in its tracks through vaccination. That's it for today. Be kind, stay strong, stay patient, stay together, and stay well. Thank you. Masicho. Shonethan. Merci.
Thank you, Dr. Hanley. We'll move now to the phone lines, and we'll begin with Haley, Yukon News.
Hi, thank you. My first question, I know it was acknowledged there in the press conference, but following the update last week, we did have a number of First Nations leaders say that they felt lifting restrictions, that it wasn't the right time. I'm wondering, Premier or Dr. Hanley, do you think there were mistakes made in how that was communicated with First Nations and communities across the territory?
I can go first. I'm sure, Dr. Hanley, we have some conversation here as well. Over the last year and a half, there has been weekly conversations with mayors and chiefs, and we've also known that the recommendations do change based upon best advice at the time. And as a jurisdiction, we've never slowed down recommendations. I know that there's lots of concerns from folks. I've spoken directly with several chiefs and community leaders over the past few weeks, as I have throughout the pandemic, and same with my colleagues. We're listening. We're developing our new documentation to get, as we go from restrictions to this new pathway forward of as the pandemic turns into an endemic. The conversations we have with leaders are going to shape these types of documentation. Our message to them is that our government will always be there for the safety of Yukoners. And as we turn the page, I think the doctor was very eloquent in outlining the future here. We need to make sure that we're always in constant communication. As recommendations come out, I will say, a a lot of times the chiefs will know before my other MLAs, my other ministers know, because these are recommendations. The recommendations independent from us as a cabinet. Once those recommendations come out, we work on how to implement, and that's what we do with the chiefs and the mayors as well. We have many tools available to support Yukoners in the communities, and we're getting on that path to recovery, and we are switching our approach from restrictions, from, as Doctor says, the heavy hand of governments nationally, internationally, and locally. But what we're going to continue to do is to provide the support when and where necessary in every single community. We'll continue to follow the recommendations of the Chief Medical Officer of Health, and I urge the chiefs on the call. There's a lot of very progressive work happening with their governments right across the Yukon, urging them to make sure as they do their recommendations to follow the doctor and his team, because he has done an impeccable job over the last year and a half of keeping us safe. We've been in the past where we've had changes and recommendations from the canceling of the games early on, all the way through to the masks no longer being a requirement. We know that these changes always come with a lot of scrutiny, fair enough, and a lot of opinions. But the true north in the pandemic in any jurisdiction in the world is those jurisdictions that follow the best advice from the medical community are the ones that fare the best, in my opinion. Not even my opinion, I think that's statistically relevant information. And, with 8 out of 10 Yukoners fully vaccinated and case counts decreasing, the restrictions, they're no longer justified. And we have a responsibility to lift them. But again, the most important thing is the communication will always be there. We'll always continue to have these conversations. We're going to continue to move forward. And, the concerns of the chiefs is being adhered to. We're listening to the communities, and we're listening because we need that advice. Who better to tell us what's happening in the communities than the leaders, the mayors and councils, the chief and councils. There's a lot of unelected leaders in communities as well, and our ability to make sure that we are in communication with these folks is truly important. And I have to say, the doctor is one of the most empathetical persons I've ever met in my life. When he's making recommendations, we always talk about science, but the mental wellness of the communities, just wellness in general, not just specifically to the science. I need to reiterate how important that is to the doctor and his team in understanding community well-being. And those conversations, I would even hazard a guess that the amount of conversations, direct conversations with chief and councils and government, and specifically doctors, the Chief Medical Officer of Health, this jurisdiction does a very good job of that in comparison to other jurisdictions. We know that things came quick last week, that's for sure. We didn't have a regular meeting on Tuesday. It was on Wednesday instead with the chiefs, and it was met with, and I think too, every time that a new recommendation comes in that is different than where we've got accustomed to, there's always going to be concerns. And the chiefs, we met as a government. I met with them. Dr. Hanley and I met directly with the chiefs yesterday at noon, and then there was another meeting with chiefs and council, mayors and council again later on in the afternoon. All of those weekly updates, those conversations are extremely important to us because we get to understand, not only just the concerns, but also what we're going to do together. A shout out to Chief Chasse in White River. I'm seeing that they're working on a campaign or a vaccination campaign in their community. I applaud those efforts. I applaud the efforts in every community. The chiefs and councils, the mayor and councils are doing what we're doing. They're doing everything they can in their power to make sure their community is safe, and I commend them for that work.
Thank you very much. Haley, do you have a second question?
Thank you for that answer. My second question, kind of related, I suppose. I'm guessing, or I'm wondering, for businesses or First Nations or municipal buildings in the rural communities that would like to request that people wear masks while on the premises, if SEMA enforcement officials are no longer available to respond to any conflicts around that, does that fall to the RCMP? I'm just wondering, when it comes to conflicts about mask use, what's your advice to business owners or officials?
I think, again, as we prepare for the new normal, if there's a disturbance in a business, then people know what to do if there's a disturbance in a business. You're right that once SEMA comes to an end, we no longer have that tool, that blunt object to enforce, to fine, or to restrict.
Thank you. We'll move now to Luke, CKRW.
Hi, this would be a question for Dr. Hanley. I'm wondering if there's advice going towards some businesses moving forward to keep certain measures in place, such as plexiglass sneeze guards and directions and lines on floor to encourage spacing. If that's something that might be advised for indoor spaces moving forward, long after we get through the worst of this current wave.
Yeah, thank you. I do. I do think these are, for one thing, there should be no hurry to get rid of anything as of next week or in the weeks to come. And again, recognizing, we are in a situation when we have lots of COVID circulating, and I think that could continue, and in fact, that might be long term. So, It also gives us that time. I mean, things are happening quickly right now, and we don't know exactly what the fall is going to look like. We have winter viruses poised to re-enter the territory after an absence for more than a year. So there's lots in the mix that's coming, and I think people have worked hard on working out protocols that seem to work for business flow. I think there are other benefits, other benefits of just keeping people mindful of each other, protections from other respiratory viruses that may be afforded by the plexiglass. I would not be in a hurry to take things down right now, and I think in time we'll kind of learn what really is the right fit and what works well both for the safety of customers and for the thriving of the business.
Thank you. Do you have a second question, Luke?
I do. It's another one for Dr. Hanley. I'm also curious what your thoughts are on vaccine booster shots. I know there's been discussions about it in the United States, not so much in Canada right now, but I was just curious to know your thoughts on that moving forward and what that might look like up here.
Yeah, I mean, it definitely is something under discussion at national tables, and we do see international examples of this playing out already. So I can say that at some point, yes, there will be a booster. There's lots to sift through as yet through emerging evidence. Of course, one of the key concerns is how long do these vaccines actually last, and how long can we rely on that protection? And that really, of course, is something that we learn from month to month, the durability of the vaccines. It also could easily be that there are actually different recommendations for different age groups. That it could be that, for instance, older people with less robust immune systems might need a booster earlier than younger people who might have enduring immunity and also, of course, not as high susceptibility to COVID. There's also the question of how variants play into that, and would it be better to wait for a vaccine that is actually modified according to circulating variants rather than the present version. And of course, Pfizer and Moderna are working on other versions that are variant adapted. So, and there's new vaccines in the pipeline as well. There are new vaccines that may play different roles and in terms of boosters. And there's the really important question of the rest of the world that is waiting for their first doses as well. And I think that is a really important part of this decision making as well. It's how do we participate? And that's not just Canada, but Yukon as well. How do we participate in that quest for equity, global equity for vaccine access? Because it's not only in a humanitarian interest, it is in our interest to have the world covered with vaccine as fast and as much as possible to protect all of us from future variants.
Thank you. We'll move now to Tim, Whitehorse Star.
Yes, good morning. First question is for either the Premier or the doctor. Specifically, there seems to be a lot of confusion around case counting and general numbers, particularly in the Watson Lake situation at the moment. How do you go about handling that confusion?
There's always going to be, some errors made along the way as far as, numbers, but we correct any errors that we see as soon as possible. I think on the whole, I think the government has done a great job of getting that information out in a timely fashion as quickly as possible. And I do want to thank the staff who work diligently on continuing to serve Yukoners. I am told that Yukon.ca is up and running again, which is great. It's still Team Yukon that's working to continue to keep our territory healthy and safe. And, we will provide the most accurate information, the most up-to-date information, and we're human. Sometimes mistakes are made, and quickly they're remedied.
Thank you. Do you have a second question, Tim?
Yes, this will take a little bit of crystal ball gazing, but I'm just curious. Hopefully this wouldn't happen. But if, with the opening of the restrictions, if the situation gets worse, we have another outbreak comparable to June, et cetera, at what point would you as a government and public health start to backtrack on some of these measures?
I wouldn't classify it as backtracking. We'll do what we always do. The current situation is what determines current recommendations. Those, as you've noticed, Tim, over the last year and a half, those current situations change. Sometimes they change rapidly. We're all hoping that the vaccine awareness is going to increase. We're hearing stories nationally, internationally of, a new understanding of those people that are unvaccinated, and hopefully there's a good portion of those folks that we can work with to get the most updated information. That's our best tool. Our focus is to, make sure that everybody who can get vaccinated gets vaccinated, and get through the din of the noise of misinformation and really identify those folks that can. But yeah, there's always going to be risk in everything we do, and there's going to be risk with COVID. And I think, just looking back at the last year and a half, you'll know what we'll do as a government. We will take the most current situation and we'll apply the most current science.
Yeah, I'll just add a couple of comments. We're facing a pretty tough variant right now, and that's the Gamma variant. It's highly transmissible. It can affect fully vaccinated people, as we see, slightly more than wild-type COVID can. I really, and it will lead, and we have seen 100% of household contacts being infected. So this is we're already dealing with a tough variant, and when this variant came in, we had our second dose. When we first detected this, this increase in cases, we were at about 72, 73% 18 plus adult vaccination second dose. So now we're at 80%, and we're moving forward, and we have most, or 60% and counting of our 12 to 17. I would rather face Delta with 90% eligible adults and 12 plus vaccinated than Gamma with 73%. I think, again, our protection against Delta and Lambda and Zeta and Omega is going to be vaccination. So let's get going.
Thank you. We'll move to Julian, CBC.
Hi there. I have a question for Dr. Hanley. Lots of news coming out of the U.S. lately. From the CDC, they're saying they're sort of reneging on the mask wearing regulations, and they're saying that masking is required in certain indoor spaces. Come next week, we're dropping that mandatory mask wearing requirement. I'm wondering just how you feel, about the CDC coming out and reneging on that rule there, and whether making you reconsider possibly the dropping of the mask wearing requirement.
Yeah, thanks. What CDC says, everyone should definitely pay attention to, as we always do. And I would call it not so much reneging, but modifying their advice and their recommendations based on evidence as they see it. They and to be clear, that they are giving advice and recommendations, but they do not issue regulations. So what they are seeing is what we have been watching and anticipating for many weeks, if not months, and that is the rise of Delta in the U.S. and now in the provinces. Even in the provinces, we're seeing that. The U.S., I think, is problematic because it's going to be a much bigger case of what we have been seeing here. There are many unvaccinated people in the U.S. And of course, in some states, they have less than half of their adults fully vaccinated. As we've described here, there's a high correlation between people who are more vulnerable to severe disease and unvaccination. So I think a lot of the states are already experiencing severe demands on their healthcare system, and I think in many areas it will get worse, a lot worse, before it gets better. So that is a worry, and that is also where you will see fully vaccinated people also get infected and potentially lead to transmission. So it makes total sense that when you have high COVID activity, that it's a good idea to wear a mask in an indoor place, and I still think it is. And when we have a lot of COVID activity here, I will still wear a mask in an indoor public place, and I think that's a good idea. But does it mean that we have to mandate it? I don't think so. I think we have to give as best advice as we can and work with our partners and organizations to get the right message out. So an example is our team is working with the City of Whitehorse right now on mask recommendations for buses and facilities, and I think it's a really good idea to keep wearing a mask in indoor public places for now.
Thank you. Julian, do you have a second question?
I do. Interesting that you're working with the city to sort of map out mask wearing in buses, etc. But I guess I'll move on. Things are happening very, very quickly. That 2 weeks ago, there was a vaccination rate goal for 95%. It's still very much there, continuing to mask up. And now, we're fast approaching August 4th. I mean, it raises the question, what was some of the guidance that you provided to Cabinet, some of those recommendations? And I guess, part and parcel of that is what sort of pressure have you been under as well from, the communities in Yukon, but mainly, what was the advice you provided to Cabinet just in this really accelerated time we're in right now?
Yeah, I would say that we have had our sights on summer and through the summer, and I think we've talked about that in some of our media conferences, that, looking towards an opening up of the summer and an eventual end to the emergency. I think that's always been on our radar. I think if anything changed, it was that we flipped around our recommendations for quarantine requirements versus gathering sizes, because we realized when we were pursuing the modeling and watching what was going on with our current activity that, as I said, the highest risk was internal and not external anymore. And so probably the biggest switch was that we recommended a change in the order of lifting from holding on to quarantine and letting gatherings increase to doing it the other way around, because it just made a lot more sense based on the modeling and the epidemiology that we're seeing based on COVID activity in Canada, rising vaccination rates, and our current situation. So I didn't feel any particular pressure, except that the pressure of working in a pandemic and having to make timely decisions, I think, is very important. There was no one leaning on me, but of course, everyone wants information and everyone wants answers, and that's normal. So it's a high pressure environment. It always is, but there was no particular pressure to do anything in any one way. We also set some general recommendations, and it's a government took that information, and the exact timelines are not my decision. The exact timelines are government's decisions according to our general advice.
Thank you. Premier Silver?
Yeah, I just agree with all that, but just also add, when you ask the question of what recommendations do you give to Cabinet, they're the recommendations that you hear here. That's what we get. And, like I said earlier today in answering my questions, we'll have Dr. Hanley and I have a one-on-one. Sometimes we involve Minister McPhee as well, who's, of course, our Minister of Health and Social Services, and also our Attorney General, and we'll talk about the logistics. A good example, when schools are going back in, talking about how we're going to make sure that the folks at the schools are informed right away. These conversations happen in earnest, but the first folks to hear about the recommendations are here, for the most part. Cabinet then starts working on information, working on guidelines, working on the policies, but there's no change in information from what the doctor recommends to myself than what you're going to hear here. That is an independent office. It is, the part of Health and Social Services, and the good doctor is a government employee, but that office makes independent recommendations, and we work on the policy.
Thank you. Et maintenant, Vincent, Radio-Canada.
Oui, bonjour. Une question en français pour Dr. Hanley. Je me souviens que vous parliez du fait que le masque pouvait devenir, vous devez peut-être s'inspirer de ce qui se passe dans les pays d'Asie comme le Japon, de garder le masque. Et finalement, ce ne sera plus le cas, pas obligatoirement en tout cas, pas imposé par le gouvernement. On rouvre les frontières, etc. Je veux savoir juste si vous pouvez résumer en français ce qui fait que vous êtes assez confiant qu'on puisse mettre en place, lever ces restrictions-là maintenant.
So, Dr. Hanley, could you please repeat in French what makes you confident that it is the good moment to remove some of these restrictions, and most importantly, those surrounding masks, given that in some other countries it's part of the usual functions, and we are not going to require it anymore in the Yukon?
Oui, merci pour cette question. C'est important pour souligner, je crois, qu'on est dans une situation meilleure que la plupart du monde à ce moment, basé sur le taux de vaccination. Donc, avec 80% des adultes déjà plein vaccinés, ça nous donne plus d'avantages pour protection de la population, et c'est un taux en train de croître, croître aussi, donc ça va agrandir avec le temps. Donc, c'est aussi une question de est-ce qu'on peut justifier une demande sur une population presque pleinement vaccinée. Et est-ce que c'est trop dur un instrument pour les moyens qu'on veut on veut accomplir. Donc, c'est un changement d'une loi pour un guide et une recommandation. Donc, et c'est aussi une stratégie pour comment survivre dans le long terme avec COVID. Parce que est-ce qu'on peut contempler un état d'urgence qui va durer pour des années peut-être? Si on a des utiles comme vaccination et une connaissance du virus beaucoup plus logique qu'avant, on a tous les moyens qu'il faut dans les mains sans la nécessité de continuer avec un état d'urgence. Donc avec l'état d'urgence, une partie d'un état d'urgence est qu'une loi pour exiger l'usage de masques. Je crois que avec les bons conseils et avec la bonne surveillance et une bonne communication et information sur l'activité de COVID dans la population va faire pour la majorité ce qu'il faut pour nous protéger, pour le protéger et pour nous protéger. Donc, de porter les masques dans les circonstances où c'est logique de porter un masque. Par exemple, à ce moment, loi ou non-loi, c'est important et c'est logique pour porter un masque dans les espaces intérieurs. Donc, c'est une partie d'un mouvement pour une nouvelle façon de vivre avec COVID, effectivement.
Thank you. I won't ask you to repeat. You've addressed most of that in English. Avez-vous une autre question, Vincent?
Oui, merci. Vous parlez d'un tournant dans la pandémie, dans la gestion de la pandémie. On avait limité le risque, maintenant on l'accepte. Est-ce que c'est la volonté aussi de faire peur et d'avoir un effet sur la vaccination? Parce qu'en Europe, on fait l'inverse. On met plus de contraintes contre les gens qui ne sont pas vaccinés. Est-ce qu'ici, en les levant, vous espérez que ça aura un impact sur la vaccination?
So as we are turning the corner on some of the measures that we have right now, and you're recommending of easing on the restriction, whereas in other countries in Europe, for example, they're trying to increase restrictions or put more pressure on people through restriction. Are you hoping to increase the uptake of vaccination by easing out on the recommendations or on the restrictions right now?
Pour moi, c'est pas le but de stratégie. Le but de stratégie de tourner vers une nouvelle direction pour concentrer plus sur les besoins des gens, pour les encourager, pour être vaccinés. Donc, c'est pas que on enlève les restrictions pour les faire peur, pas du tout. À mon avis, c'est pour avoir le bon moyen, les outils plus sophistiqués pour adresser les concerns, les questions de les gens non vaccinés et pour concentrer. Et pour reconnaître que la risque ne reste plus avec les frontières. La risque, c'est avec les rassemblements dans les territoires. Donc, il faut pour le moment limiter les rassemblements et continuer de faire les efforts chez les populations non vaccinées.
We'll move to Camille, Canadian Press. Looks like Camille has left us, so I would like to thank everyone for their time today. The next COVID-19 update will take place on Wednesday, August 4th at 10:30 a.m.